All right, good morning and welcome back to another edition of Bakersfield Business Partners podcast. My name is Duncan Harris. I'm the owner of Insurance Savings Group and the past president of Bakersfield Business Partners. We're a networking group. We meet in Bakersfield every Tuesday morning, and we're helping our members grow through referrals, but also through education and relationships. So we've got the best group in town, and the reason why is we have the best members. So each week we get to highlight one of our members. Today we've got Jeff Haynes with us. Good morning, Jeff.
Good morning.
How you doing today?
Doing
Happy
great.
Friday. Jeff is a chiropractor. He's been a member of our B&I group for a long time. I know he looks old, but it's a really long time in our group. And just wanted to kind of check in with you, and then we're going to go over some different things. This is your second time on the podcast.
Correct.
And we're going to kind of dive into maybe a little more about chiropractic and what you do, and hopefully give people some really good advice. So give me a real quick rundown of your business and how long you've been doing it.
Okay. My business is Haynes Chiropractic. We're on Stockdale Highway near the new overpass with the freeway that's coming in. Been there since 1999. I started back in Bakersfield in 1992 with another doctor, and then bought his practice out in 96 and been on my own ever since.
Very cool. Do you know how long you've been in our B&I chapter? Just out of curiosity.
I don't have an exact
You were one of the
year.
first ones, weren't you?
Pretty close. They got together, and I would say within the first year they did a membership drive, and that I was kind of the product.
And you
of
were
that.
there.
Yeah.
Well, good for you. So you've been a chiropractor a little while, but let's kind of dive into the basics. Like, why does someone need to see a chiropractor?
Well, there's two sides of that. I mean, most often you see people that are dealing with pain-related issues or injuries, and we'll see them on that. I mean, some people ask, who should I see first? Should I see my doctor or should I see a chiropractor? When you look at that, it depends on what your situation is. Obviously, if we're talking about musculoskeletal injuries, neck, back, shoulders, elbows, knees, things like that, and there's a need for medication, if you're in a severe pain, sometimes you need to control that pain first before you can seek any treatment. And that would be I would say, see your physician directly that way, get your pain under control, and then we can see it. But most of the time people are in pain, but it's not to that severe degree. And if you go to your physician, he's going to evaluate you and maybe give you an anti-inflammatory, a muscle relaxer, but still that's about all they're going to do. And there's not a whole lot more they can do. I mean, they may refer you out for x-rays, or they may refer you out to physical therapy, possibly chiro. But if you come see us first, we're going to do an exam, we're going to do x-rays if needed, and we're going to start treatment right away and try to correct the problem versus giving you a drug that's going to try to mask over the pain, hopefully that your body forgets about what's going on, so you can kind of move back to normal stasis.
Yeah.
Now there's the other side of this, as people will do it for more of a health conscious person. It's like, well, why would I need to come in, if I'm not feeling any problems? But your nervous system controls everything in your body. And, if you're working out, you're trying to stay on the top of your game, why would you not want your nervous system running at top level? And by getting a chiropractic adjustment, making sure everything's moving freely, there's no impingements on the nerves, everything's firing the way it should, then your body's just is going to be that much more enhanced, versus not having chiropractic.
So, I mean, if I've got an issue, like a pain issue, and I go see a doctor, they might be limited, or maybe they're just like their first thing they're going to try is to just give me pain medication. And maybe what you're saying is like, hey, there's an underlying issue that you can treat by manually, manipulating or adjusting the body in some way.
Correct.
So, I mean, why, I guess we shouldn't get into a bigger conversation, but I wonder why doctors do that. Like, it's just not up their alley. They don't have the training that you have, apparently.
No, they do. I mean, they're just dealing with a different type of client. I mean, they do musculoskeletal injuries, but there's not a whole lot they're going to do. I mean, versus dealing with somebody that has high blood pressure, that's diabetic. I mean, that's going to be the majority of what they're dealing with. I mean, they'll deal with, but they don't really have an answer to try to correct that other than a medication and a referral somewhere else.
So, I mean, I know people a lot of people would think, hey, I need to have a doctor. I need to have a relationship with a doctor or someone I can go see when I get sick. Do you think it's maybe just as important to kind of have a relationship with a chiropractor or to see a chiropractor on a regular basis? So like to have that resource?
And it's what's interesting. I've seen patients, the same person year after year after year, and I'll always see them in a crisis mode. They wait till they're dying to get in, versus like if you just come in periodically to stay ahead of that, then I think you would do a lot better.
Right.
My adage on that is like, pain is kind of like or issues are kind of like a drip in a bucket. That drip is constantly there. And if you don't do anything about it, eventually it's going to overflow, and then you're going to be in crisis mode. You're going to need to get treatment and get it corrected, versus if you just come in periodically to stay on top of that, you're going to be a lot better.
Yeah. So, let's talk about maybe the reasons why people don't come in. Maybe they think, hey, look, man, I can twist my back, or I can pop my neck, so when I pop my neck, is that doing the same thing that you're doing?
No, it's not.
Yeah.
It's not. Because I'll get all the type of people like going, oh, I can adjust myself. And I'm like, wow.
It's not the same.
You should be a chiropractor then, because I'm a chiropractor and I can't adjust myself. I mean, I go and I see a chiropractor too. I get adjusted regularly. I mean, it's just, the problem is when you try to so-called adjust yourself or pop yourself, you're moving a joint of the spine that's already moving normally, and you keep pushing that same area, and it's like, and you'll hear a pop, and it's like, oh, I'm getting everything. But we're trying to find those areas of restriction or fixation that aren't moving, and we put motion back into that joint to restore motion and get the pressure off the nerve so everything works right. And that's the difference. We're finding those areas where there's issues, not just necessarily just randomly, twisting your neck or
just popping whatever pops, essentially.
Exactly.
If I come in, and I'm just doing like a maintenance thing, maybe I'm coming in every other month or something, how long does the visit take?
It just depends on what.
If I'm in pretty good shape and you're just kind of keeping me adjusted, we're doing maintenance, like what is that?
Anywhere from 10 to 20 minutes. I mean,
that's pretty quick.
Yeah. And what we do in our office as well. I mean, there's some chiropractors that don't do therapies. We do. You come in the office, we're going to put you on a table, put you some electrical muscle stim on your back, some moist heat, just trying to relax your body a little bit, just make the adjustment a little bit easier.
Yeah.
Some people, and then there's some chiropractors that don't do therapies. You just come in, they adjust you, you're in out. Obviously, it's the adjustment that really is the thing that's really resolving a lot of issues, but you add a little bit of therapy on top of that, and it just kind of heightens, I think, that experience and, that the ability to feel better that much more.
Sure. No, that's great. What are some of the other reasons people come to see you? What about people that have an injury, or maybe they've been in like an auto accident?
Yeah, I do workers' compensation claims. I do auto accidents. It's interesting with auto accident claims. A lot of people, they get in an accident like, oh, I'm fine. I don't think I need to see anybody. And then they wait 2 or 3 weeks.
What is that mentality? Is that like hey, nothing hurts too bad, or like I don't want to be a victim? Like what?
I think a little bit of both. I think a little bit of both.
Yeah.
Because when you first have an injury, you're in a little bit, I think, shock. And everyone I talk to, it's like, I was just kind of dazed a little bit about everything.
Right.
And the next day it started hurting. And then just progressively kind of got worse. Sometimes people don't have insurance and they're kind of worried about the cost of things. If somebody hits them, the other person is at fault, the insurance is going to cover that, but sometimes they don't cover that right away. So you have to get your treatment and then try to work with insurance afterwards. So sometimes there's some hesitation there, but usually it's always better just to go get checked out, even if there's not a whole lot going on, make sure that you're fine, or that there's nothing really serious going on, and then if there is some issues, you can kind of address those accordingly. The longer you wait, sometimes it can kind of hamper what the insurance company will tell you. It's like, oh well, you didn't see anybody for a month, why can you be hurt that bad? I mean,
so that case, people like they have the accident, it doesn't hurt that bad, it starts to hurt, people think it'll probably go away,
exactly,
and then it doesn't, and now it's been a month. And then, oh crap, they realize this isn't going away. I need to go figure this out.
Right.
Is that what's going on there?
Yeah, pretty much. So it's, that's why it's always, and from the standpoint of when people are dealing with insurance companies, that can be a little bit of they'll sit there and look at that going, wow, you had you didn't go in right away where you really hurt that bad. And it's, and all you're trying to do is, most people just want to get treatment, get well, and get back to their life.
Yeah. Could someone come see you if they don't have insurance?
Absolutely.
Yeah. And they just pay cash or credit card or whatever?
Yes.
Okay, good. Good deal. So, let's talk about a little more about the work comp injuries, the auto injuries. Obviously everything's a little different, but you must have a track record of, hey, we get these people in, we get them on some kind of program, and then we're able to kind of get them back to
correct
normality or normal stasis. Just how long does that take? I guess it depends.
Yeah,
but
it really depends. I know a lot of times with some of the injuries, we'll start them on a treatment program, and we'll give, within a month, if they're not getting better, there's got to be some underlying causes. So we'll try to refer them out for MRIs to see if
that's not long. Within about a month, they're either going to have improvement, or hey, it's not getting better, and then there's something more serious going on here.
And that's when there's a referral process. You do some testing to see what's going on, and if there's something comes up positive on that, we can continue to keep treating them, but we'll refer them to a specialist, to get a second opinion on those too. Because chiropractic is not the end all for everything. We're a good starting point, and we can resolve a lot of things, but sometimes you have to push it down the road, and for other things to be done to get them where they need to be.
Now, these people who are coming in for injuries, does that injury, let's see, is that something that might cause them to need to see a chiropractor like every year? Like, hey, we just want to make sure everything's looking good, or does it kind of go back to normal? Or does that make sense? Like,
no, it does.
If I had cancer, I would make sure every year after that I go get my cancer.
No,
screened.
exactly.
You know what I'm saying?
And if you've had an injury, car accident, and you get some whiplash, definitely with whiplash, your head whips forward, it whips back. You can stretch some of the ligaments. And obviously with treatment that we're trying to get that back to a more normal position, but there is still some injury there, which could have some lasting effects. And that's where, chiropractic care on a regular basis can just kind of help keep you. And that's the thing too, people like, oh, you got to watch out for chiropractors because, they're going to get you addicted to chiropractic. And it's like, so is that the same thing as going to your doctor saying, okay, the doctors are getting you addicted to blood pressure medication and diabetic medication? You're taking things because you're trying to help your body. The same thing with chiropractic. If coming to a chiropractor once a week, every other week, once a month, every other month keeps your body feeling good, moving, and not having to take medication versus having to take, Advil on a daily basis, is that being addictive? And I say no.
Right. Yeah. It's either Advil every day or, the chiropractor every other week or something. I get it. So if I'm on pain medication, if I'm just listening to this podcast and I'm taking pain medication every day, should I be like rethinking, like maybe I just need to go get checked out by a chiropractor?
Yeah, it's absolutely. I think are we going to be able to get you off that pain medication? Possibly. I'm not going to say, yes, we're going to get you off that pain medication, you're going to be perfect, because there's a lot of underlying things going on versus arthritis, so, but if they've never been to a chiropractor before, absolutely. And of course, you have those people that are absolutely I'd never see a chiropractor. And my thing is on that are like, well, I know somebody that went and saw a guy, and I'm like, okay, so my question on that is if you went to a medical doctor and didn't have a positive experience, would you just say, I'm never going to a medical doctor again? No, there's good and bad in every profession.
Yeah.
So, you find those people they're going to give you what you need, and I think that's important. Not just you have one bad experience and then you're done with that for the rest, just because of the stigma sometimes that can be with chiropractic.
You were talking about the other day about how a lot of times the pain, not that it's disguised, but it's hard to perceive where it's coming from. Where you were saying, like, people would tell you, I have hip pain, but actually that the nerve in their hip is wrapped around to their back. It's wrapped around to their spine.
Well, you got referral pain too. So, in your pelvis, where your sacrum attaches to the pelvis, or to the iliums on each side, you got two joints called sacroiliac joints.
Okay.
And a lot of people say, I got hip pain, and they're pointing to the back of their back, off to the side, where your hip is more towards the front on the side. But that SI joint can refer pain into the hip and into the groin too. So, I mean, you can, a lot of times like, oh, it's my hip, and it's not necessarily the hip. It's just another area that's referring pain there. So you address those issues, and that, that'll
could go away.
Most likely take that pain away.
Yeah. You probably had some clients. I know one of your clients that they come see you faithfully, year after year, and just make sure they're in tip top shape.
Yep. I mean, I have people that are doing it for health.
Yeah.
And I have a lot of people who are like, I'll see you when I hurt, so it's just, just trying to educate people. It's like, just trying to stay on top of it. I mean, if you think about, you look at the population of the US today, for obesity, it's huge. I mean, so people aren't exercising, they're overweight. And that's where my thing is I always ask people, do you exercise? Well, and they're like, well, should I? Well, yeah, you should, but let's be realistic. Do you normally exercise? Yes or no?
Right.
And if it's no, then chiropractic is probably going to be even better for you, because we're going to help to put mobility into the spine, keep it moving like it should, and have a less likely time of, having, lapses or pain.
So that person who's not, let's say, exercising on a regular basis, they're probably the guy that goes out to load up their truck for a weekend camping trip, and they blow out their back or whatever because something was out of alignment, right? Is that kind of the
exactly.
issue where you're not doing anything?
Or the weekend warrior, they're going to go out with their buddies and, and play softball or something like that.
Right. And so then they go out, the body's not used to this full range of motion they're trying to be put through, and then boom, something seizes up. Now they're out for a week or something. And you're just saying, hey, look, come in on a regular basis, whatever that is, and we'll just make sure that your body's tuned up.
No, exactly.
Essentially. Okay. What else? I mean, we've kind of talked about people doing it for health and for pain, but I think you do a lot of other things. What else do you do down there?
We do a lot of Department of Transportation physicals. So if you're a truck driver, or you need a Class A or Class B driver's license, you have to have an annual or biannual or physical. So depending on what you're taking as far as medication. So it's every 2 years, unless you're on a medication like blood pressure medication or diabetes. I mean, those are the two big ones right there.
Where do these guys usually go to get their physical done? Is it like a doctor's office, or where?
They used to be able to have any physician could do, or chiropractor to do these exams, but the Department of Transportation changed it up a little bit. And so you have to do a certification program and take a test so you can get on their be a list of their doctors. A lot of the physicians were kind of took it like, well, I already know this stuff. I'm not going to waste my time doing this. So they're not doing it, because a lot of times you would go in and get your physical, and they would just do everything that they're doing for this exam anyways, and just kind of sign off on your physical. Well, now since you have to be on the registry, and you have to report to the registry, not just do your paperwork, most of them don't want to do that. So we do that. What's nice about our office is we have walk-in appointments for DOT exams.
That's cool.
A lot of the occupational medicine places all do those exams, but you're in line with everybody else. So you're looking at 2-3 hours, to get through the whole process with them, where we can get you in pretty. So
you guys are able to
fast.
Get people in pretty quick.
Yeah.
Good deal. And I mean, so you obviously do a lot, and then don't you have a massage person at your office?
We do. We got massage therapy, and then, like I said, we do the therapies in the back too. So we, try to, offer some, massage is really good. It's normally not covered by insurances. So, I mean, it's, it's an additional cost, but I think the benefits that you get from massage are pretty high.
So I feel like there's probably a lot of stuff going on that people don't realize. So if you could kind of give me that list really quick, like, hey, we do adjustments, we have an x-ray machine, we have massage. Give me that full list.
Okay. So, I mean, somebody comes in, we do the exam, we'll do x-rays, we'll put them on therapies. We have electrical muscle stim, hot packs, infrared, ultrasound. I mean, we can treat a lot of different injuries just with therapies. And then we also have massage therapy as well. And then with our chiropractic things that I do, we have it's called intermittent traction or disc decompression therapy.
Yeah.
Which is with this intermittent traction, we're able to work with patients with bulging disc and kind of help subside that disc a little bit and provide relief. And we've had good success with that as well. So
that's very cool. I mean, you do a lot down there. I think maybe in my simple mind, I think, hey, chiropractor, you go in, they pop your back. That's not what I mean, but
right.
And I don't think of anything else. And you guys really have like a really wide spectrum of
right.
massage and therapy and all these different treatments.
No, I think it's important. I mean,
yeah.
Just trying to make the experience a little bit better, and sometimes when you get adjusted, the body's going to react differently from an adjustment. So you're not always going to feel great from the adjustment. Sometimes it can cause a little bit of pain. Sometimes you can be a little bit sore afterwards. Those are all normal things that can possibly happen. Not all the time, but sometimes that can happen. But you do a little bit of hot pack or stem or whatever prior to that adjustment just to relax you a little bit more. I think that it definitely makes the adjustment go a long way.
So if you could summarize now, like what would be an ideal customer for Haynes Chiropractic? Like, could you summarize that? Are you able to describe that person?
No, like I said, I do. If you've been in an auto accident, or if you've had a work injury, usually with work injuries, they want you to go see their doctors first. But auto accidents is, direct referral. You can come in and see us. We can evaluate you. We can do a free consultation with you just to see if something that we have will fit what you need. Just the average person looking to get well with treatment, just wants to get adjusted regularly just to keep everything, keep themselves in good health. Or that person that's trying to get away from medication and see if we can help with their pain on a regular basis too.
Jeff, tell me what's the best part about your job?
I think it's just the interaction with the people. I just enjoy I enjoy the people that I see and being able to help them.
Good deal. Well, what else? Anything else we want to touch on today? We've kind of covered a really wide array of services that you offer. Anything else going on in the chiropractic industry or changes that maybe are coming down the road?
Not that I can see right now.
Okay.
Yeah.
Yeah, you guys are kind of fortunate, probably not a lot of regulatory changes affecting the chiropractic world, I guess, which everything seems to be touched by politics nowadays, which is unfortunate. But.
No, it does. And I think, with you being in the insurance business, mm-hmm. you see that, as costs go up for what we pay for insurance, it's really interesting. Costs go down what they're paying most physicians. So it's an interesting situation, how that works.
So look, really quick, let's have a conversation about that. You're a provider. I'm an insurance guy. So actually, I think people think in their mind, hey, if I want to go see a medical doctor, whether that's a chiropractor, a doctor, whatever, they think they need insurance first.
Right.
And then they come and they buy insurance. And what you just said is happening. They're actually paying more and more every year. Their premiums go up and their coverage goes down because the insurance companies are paying you guys less.
Right.
And what I find is that my clients, just overall in general, are probably less satisfied with their insurance. Year after year, they're less satisfied. That's why we offer these other alternatives, the Benny card, right? All these ways to go to a doctor, pay cash, pay with pre-tax dollars, pay with some way to just have access to the treatment they actually need. So I feel like that's very, very important for people to understand.
Yeah, and it's tough because you look at a lot of personal policies. I mean, if you're with an employer, the employer, and it's a big employer, they can add a lot better benefits. But the average personal policy is, $5,000 deductible. Mm-hmm. That's a lot of money to come out of pocket before they start kicking in. So really, if you're if you have a deductible that high, it almost makes you like a cash patient because technically you're paying out of pocket until that deductible is met. So, but you need that insurance because one catastrophic injury and you're not insured can ruin your life. So, I mean, it's kind of a necessary evil.
It's a balancing act. Yeah. And so people look at their insurance options and they say, okay, wow, it's going to be $100 a month for the cheap plan, the high deductible plan. But dang, it's $400 a month if I want to have a lower deductible, lower copay. And they just don't want to afford that. They can't afford the extra money. And what I tell people is, look, take the take that $300 a month that you would pay to an insurance company,
aside, yeah.
set it aside, take it out of your paycheck pre-tax, put it in a savings account or whatever. And that way, when your back does hurt, you can go to Jeff. You've already prepaid for Jeff
and that's the
everything
thing too.
else.
If you would do something a little more regular versus wait until it's a crisis mode. I mean, you're going to need a lot more treatment, in hindsight versus, doing it up front, and that I tell that all the time. It's like, what they say, an ounce of prevention is worth a pound of, cure, and that, but our medical model is not in,
prevention
at
all.
It's all about treating
symptoms.
Exactly.
Yeah. So like you're saying, hey, the symptoms are a drop in a bucket. And I feel like the doctor's going to add chlorine water to your bucket full of water, chlorine. And you're like, hey, well, the water's clean. And you, with a chiropractor, be like, we're going to turn the drop off. Like, we're going to figure out what's actually causing your pain. And look, I'm not a medical provider. I'm just a lowly insurance person. Right. But that's what I see from my clients. Like, yeah, I went to the doctor and I bought this insurance, went to the doctor. Oh, are you doing better? Not really. Yeah, I've had back surgery. How's it going? Well, I need another back surgery now. So I feel like, I don't know. I guess I see
look
it.
at what we do too. I mean, you're talking about back surgery.
Yeah.
Back surgery is not one of those things that you want to tread lightly on. And I'm not saying, we can, there's a lot of things we can treat, but, you have to know what you can't, where your limits are. And obviously if it's not getting better, you have to, you're going to have to, let the specialists look at that stuff. But most back surgeries are done for pain.
Correct.
And there are studies out there that have said, that if you take two people, one that has, that both have pain that the same, one has surgery, one doesn't, usually within 5 to 6 years, they'll both be about the same. And my thing is but if you're in a lot of pain and it's super debilitating, I mean, you're like, just got to do something to fix this. So, I mean, there are those times where you need to do that. Obviously, if it's neurological or, you're losing muscle strength, I mean, there's immediate things that need to be done. But if pain's the main one, if you can kind of get through that, but I understand that too. I mean, there's only so much you can do with pain. And now that this whole opioid addiction things going on, most doctors are not prescribing pain medication. So I think that may drive up surgery a little bit. I mean, that's just my own opinion.
Sure. But people need to be aware of that.
Yeah, but
definitely.
If you can try doing something proactive that'll keep that pain down. I mean, we may not be able to get rid of the pain, but if we can keep it at a dull roar, versus just being loud and just hurting, then I think we're doing our job. I mean, we're not going to be able to fix it, but if we can control it, then that's what you think about medication. They're not fixing it; they're controlling things.
Sure.
So if we can help control your pain and keep you where you need to be without taking the medication, then we're doing our job
in a natural way. I love it. All right. Well, look, we're actually out of time. Jeff, thanks for coming on, and always good to have you. Thanks for being a member of the group. And until next time, if you want to check out our meeting, it's a group of professionals, and we just educate everyone on what we do, how we're different, what sets us apart every week, and then we can give referrals to other members in the group. So come check us out, Bakersfield Business Partners, and until next time, we'll talk to you on the flip side.
All right. Thank you.